Migraines are a very common phenomenon, and they are very underdiagnosed in the general population. Migraines are definitively different than just a regular headache. And there are migraine headaches that are called common migraine headaches, and then there are also migraine headaches that are called classic migraine headaches. The difference between those two types of migraine headaches is that classical migraine headaches, people can sometimes get visual phenomenons with their headaches where they can see shining lights, they can lose their vision, sometimes they can get some numbness or tingling with their headaches. Migraine headaches are typically associated with a unilateral headache, meaning that it's typically on one side. Patients will get nauseous, oftentimes throw up. They get sensitive to light and to noise. And the headaches typically last for many hours, as opposed to sometimes people just get a bad headache, but don't typically have those other type of features always associated with it. They may have one of those features, but not a realm of all of those, as I stated. Headaches can be very disruptful for people, and that's one of the questions we always ask in the clinic is, are you missing days of work? Are you missing social events? Are you having to stay home? Are you missing school? Because they can be quite debilitating for people. And so it's important if you're having headaches like that to come in and get treated, because there are a lot of medications that are available to get you to be allowed to go back in and doing the social events and not missing work and such as that. There is a genetic component of migraine headaches, and so we often see that people that have migraine headaches also have a family history of migraine headaches in parents or grandparents or aunts and cousins. Other reasons for people getting migraine headaches can be related to environmental causes. Sometimes people that are staying up late, people that are drinking a lot of alcohol can sometimes trigger migraine headaches in patients. And sometimes people will just get migraine headaches and we don't have a reason for them getting migraines. Stress is a big factor for migraine headaches, and I ask all my patients about stress, anxiety, and depression, as well as sleep. In a world where everybody's on go, people really skip on sleep a lot. So an average adult needs 8 to 10 hours of sleep at night. And so when I'm seeing patients for any type of headache, I always ask them about stress, sleep, mood, because I tell them it's kind of like a big rolling ball, that if you start getting migraines and then all of a sudden you start not feeling well and your mood drops, well then it makes you perceive pain more, and then all of a sudden that pain causes problems with sleep, and then you're not sleeping very well, and then you've just got this big kind of continuing snowball effect with these headaches that become very difficult then sometimes to treat. Sometimes migraine headaches, people don't seek medical attention because even though it's a really bad headache, some people are fortunate enough that they can just take an ibuprofen or a Tylenol and it'll make their migraine headaches go away. Typically people will seek professional help or go to their physician if they've got headaches that won't go away. And for migraine headaches, we kind of decide on treatment based on the frequency and severity of headaches. If patients are having headaches, usually less than 8 times per month, we'll try to treat them on what we call as abortive medications, meaning a medication just to take when you get a headache. If people are having headaches more than that, like 9 times a month or more, then we'll place them on prophylactic medication to try to prevent them from being on headache, or try to prevent them from getting a headache to begin with. Some of the abortive agents that we use are triptan medications such as Imitrex, Relpax, Maxalt. Some of the preventative medications we use are 2 FDA-approved medicines. One's called Topamax and one is called Depakote. There's also recently been FDA-approved as the use of Botox injections for migraine headache, which has really opened up a whole new window for patients that have had untreated migraine headaches. It's the same Botox that we use for the dermatologist or the plastic surgeons use for cosmetology reasons, but it has been shown to work very effective for migraine headaches. It's injected into the forehead and the temples as well as kind of back along the neck. And the nice thing about the Botox injections is they'll last between 3 and 6 months. So some of the oral preventative medicines that you have to take every day, some people don't like to do that. So Botox just gives people a different option to come in and get injections for 2 to 4 times per year. I mean, treatments are variable just as they are for any type of disease, but they're quite successful for people. Sometimes people can have migraine headaches as well as other components of their headache as well. So sometimes people can have mixed type of headaches where they may have migraine headaches, then they may also have a tension part of headache. So maybe there's some stress going on, and so we treat their migraine headaches, and then maybe we need to work on their stress or their tension, or they're having sleep deprivation headaches or caffeine withdrawal headaches or things like that. So migraine therapy has to be really individualized to the patient, but if you're working with somebody that knows how to treat migraines and how to treat headaches, they should be able to kind of help tease through some of those triggers for patients of why they're getting migraines and get on top of it and treat it.